Hello, thanks for joining us and welcome to Inside Health, your favorite health show on Signature TV, where we break down complex health issues into bite-sized proportions that is meant to help you take care of your health and your well-being. Well, today we are going to discuss a very topical issue on neonatology, captioned Silent Cries, recognizing life-threatening danger signs in newborns. Well, I'm going to introduce my guests and experts in a bit. I'm your host, Uchenna Ekwochi, and we invite you to be a part of this conversation. So go on over to our social media platforms on YouTube, on Facebook, go like, comment, share, of course, subscribe at Signature TV Official. We're also live on SLTV channel 265, and we also want you to download Signature TV app from your Google Play Store so you can be kept abreast with our latest programs. Don't go anywhere. Signature TV is here to serve you. And Inside Health continues right after this break.
We are local.
We are right now with the wife of the man that was
Despite the main market is in chaos. People
We are national.
Those in support of this motion as amended, say aye. Aye.
we have taken the vote by default.
We are international.
Israeli airstrikes.
Donald Trump left us the worst unemployment.
Signature TV, news in your pocket.
Well, if you're just joining us, this is still Inside Health on Signature TV, and today we are discussing silent cries, recognizing life-threatening, problems in newborns, neonatal newborns when they are born and they have issues. How do you recognize? How do you identify, recognize, and promptly treat these danger signs in our newborns? Well, with me is a consultant neonatologist and pediatrician. He is also the provost, College of Medicine Institute, Enugu here. He's Professor Uchenna Ekwochi. Good morning, Professor. Thank you for joining us on the show.
Thank you. Thank you, Chigi.
I beg your pardon. Good afternoon, rather.
Yeah.
Thank you for joining us.
Thank you so much.
Absolutely.
And thank you for having me.
Yes. I would say congratulations is in order. You just had your inaugural lecture on the 8th of May, if I'm correct.
Yes.
Interesting. And it was massively attended because I had to do my research, and what captivated me was the topic of your inaugural lecture, the travails of minors. And it got me thinking. So I'm going to ask you.
Thank you.
Who are the minor of minors? We understand minors, but the minor of minors, especially in a setting, a financially challenged setting like ours, who are those? Who are you talking about?
Okay, thank you so much. You are not the only one that had that challenge.
You had a very good, you had a very good play with words there.
yeah, because a lot of people, when they saw that topic online, and he raised a lot of questions. People are saying, what do you mean by minor of minors? And I tell you, Chigi, I was the one that invented that terminology. You don't see it anywhere.
I know, no, I have not.
Yeah, you can't Google it and find it anywhere. I invented it. Do you understand? Because minor, we know, is anybody that is below any
certain age.
That's 18 years.
18 years.
Age. Then inside that minor, there is now the one I described out of my experience and practice as the minor of minors. These are the newborn. Do you understand? Because we are talking about minor as people who, somebody who is dependent. They are dependent on certain caregivers for their development and survival. Then we are looking at people who are now critically dependent for their survival and development. That is the newborn.
Interesting. It actually makes sense because with the other older minors, at least they could talk, they could describe their feelings.
Yes.
But with the minor of minors,
you are talking of somebody who is critically dependent. They are down the minor. If you're in the category of the minors, you now have the minor of the minors.
Now,
That is the
in a,
newborn.
in a financially challenged setting
Yeah.
like Nigeria, what are their travails?
Well, their travails are numerous. They are numerous. And when I talk about travails, we're talking about the things that cause morbidities and mortalities.
When you say morbidity and mortality, what do you mean?
Morbidity is the diseases or troubles, take it that way. The mortality is death.
Okay.
Do you understand?
Okay.
And in that my lecture, I singled out of my experience and practice 3 major causes of morbidity and mortality in this category of children, known as the minors, the newborn. And they are the asphyxia, the neonatal sepsis, and the prematurity.
Could you break it down?
Good. Asphyxia is, simply put, inability of a baby to initiate and sustain breathing at birth. As you and I know, when you breathe, you take in oxygen. And oxygen, through all the mechanisms, is what keeps the body. So if a baby is born, is not able to initiate breathing, is not able to sustain it, it goes into causing a lot of problems within the system. In fact, it affects all the systems because the oxygen concentration will go down, and that is the state we call hypoxia, and affects all the systems, ranging from the central nervous system to respiratory system to digestive system, all the systems in the body, all the organs and systems and functions are affected.
Interesting.
So that is asphyxia.
Okay.
And when you come to prematurity, that's a baby that came out of the mother before 37 completed weeks of gestation. Now, the mother's womb is the best incubator the baby can stay in and ensure good development and survival. So, if the baby comes out before 37 completed week of gestational week, then that baby is described as preterm, premature baby. Do you understand? If you come to that category, we still have those who are extremely preterm, very
so it's a spectrum.
And it's a spectrum. Do you understand?
Okay.
So now, if the baby comes out and is being cared for in the environment, if the baby catches infection due to suboptimal care, the baby develops what we call neonatal sepsis, and is also going to affect the system. It's going to affect every organ function. So
sepsis exactly means
newborn infection. Infection of yes, presenting with symptoms and signs.
Okay. There's a third category. You mentioned asphyxia, prematurity. There's a third, and sepsis.
Yes.
Now, what are those telltale signs, even if it's one each, that a caregiver or a parent, a woman, if she's conscious, could look at in her newborn and say, no, this is a red flag?
Now,
when it comes to asphyxia, what would she look at and notice? When it comes to of course, prematurity, it wasn't up to term. But when it comes to sepsis, what are those indicators or indication that shows that this child has an issue?
Okay. Now, let's start with asphyxia. I like this topic you gave this presentation. It's a silent cry.
Yes.
You know, in our environment, we assume that once the baby comes out, it should cry. That's the general thinking. Actually, well, cry, fine. Cry connotes that the baby is breathing. But we, the clinicians, are more interested in the breathing. Do you understand? The baby should be breathing within the first minute of life or be helped to breathe. That's the golden minute.
Is that why they are turned upside down? And
No. That's a very bad thing to
do
in delivery. You don't beat a baby. You don't need to beat a baby. You don't. It is criminal. And that is what I was trying to emphasize in my lecture. I said these things are neonatal abuse. It's a newborn abuse syndrome. You can't beat a baby. Why are you beating a baby? A baby that is delivered properly should be breathing and could also cry. Do you understand? So when he cannot breathe or is not able to sustain, he may start breathing but he's not able to sustain it. That is what we describe as asphyxia.
Okay.
Do you understand? And
so
I told
you notice the child struggling with
breathing. But, well, one of the other ways you can present, which is the major thing people are looking at, is the cry. So they tell you a baby did not cry at birth. Do you understand? I will say, if he doesn't cry, but he's breathing well, there's no problem. Don't beat him to cry. It's not necessary. Do you understand? The only thing you could say, oh, he's not crying. Let's look closer. A trained hand should be able to observe and say, no, don't worry. Allow this baby. He's breathing well. The color is fine. The activity is fine. He will cry when he wants to cry. So don't bother. So this issue of turning the baby, beating, smashing, and slapping the baby, giving an injection and all that to make baby cry. What are you? Do you understand? Yeah.
Interesting. Now, there's another key word in your team. You said resource limited settings.
Yeah.
Which means you restricted their travels to resource limited settings like Nigeria. Why do you think a limited resource has a major impact on these children, on the minor of minors?
Good. I use that term, resource limited setting, because I did a work with some of my research partners in Canada and in Brazil. And we're looking at characteristics, clinical characteristics of babies that are asphyxiated in these 3 income zones, income countries. And
Canada,
yes,
Brazil, and Nigeria.
And you know what interested me so much? I found out that we got about 100 and almost 190 something patient babies. But Nigeria contributed more than 2/3 of that asphyxiated babies. So it's actually our problem. Yes. So it's actually our problem. That's what I'm saying, that asphyxia is really our problem. So over there, the incidence is very low. It's the problem there, but it's not as critical as it is in our environment.
Interestingly, so, when you pedal backwards, because asphyxiation, something may have gone wrong with either the childbirth or during gestation, which is outside of your jurisdiction, because that is OBGYN.
Good.
But is there any way pediatricians and OBGYNs can work together and identify asphyxia even before it presents?
Very good. You asked a very good question, Chigi. It is actually a collaborative thing. The issue of asphyxia cannot be tackled only by the pediatricians or the neonatologists. The obstetrician has to come in. In fact, after this, my lecture, we have started forming what we call Stop Asphyxia Movement.
Interesting.
Stop Asphyxia Movement, SAM for short. Do you understand? And that group is going to comprise of the neonatologists, pediatricians, the obstetricians, any other health worker that is interested in saving the life of the philanthropists. We're inviting them to come and join the movement.
And policymakers.
And policymakers, that's what I'm saying, philanthropists, policymakers, because we have to really fight this problem. Because it's our problem.
It is.
It is.
Talking about policymakers, in your lecture, the SSG to Enugu State Government was present.
Yeah, he was present.
What was the major takeaway for him? Were you able to find out
in that lecture,
any action points?
Good, I will tell you, because I was stressing the fact that you see now, asphyxia is our problem, and it's a bigger, in fact, it's #1 killer of newborn in our environment. But to my surprise, there's nothing like World Asphyxia Day. If you Google it, you will see it. You have World Water Day, World Women Day, World Everything Day, Everything Day. But asphyxia, because it's an African problem, it's a disease of the resource limited settings. So I said in that lecture that this year we're going to start that in ESUT as ESUT Asphyxia Day, State Asphyxia Day. Then we will now move it further.
This deserves an applause.
Do you understand? We're going to move it further to a global.
Can it be pitched to WHO to adopt?
That's our target.
Interesting.
We are actually looking at, championing that, and to the extent that it will become a global issue.
Good.
You understand? So that we can have World Asphyxia Day, but we'll start with ESUT Asphyxia Day, Enugu State Asphyxia Day. We're going to teach, make a massive education concerning asphyxia. What is the cause? How can it be prevented? How can it be handled? Do you understand?
And Signature TV would actually be on ground to help with.
Thank you so much. Thank you.
Thank
you,
because
it was one of the things that SSG actually picked up and said, work on this. Let's see how it goes.
Interesting.
So that we can tell people what causes asphyxia, how it can be prevented, since it is #1 killer of our babies.
Children, of newborns.
Yes.
Wow. But the issue, the newborn issue that is, known everywhere, everybody knows about it, is preterm, premature. What actually, predisposes a woman to having a premature baby?
There are so many of them.
Okay.
You understand? There are so many of them. If a woman is hypertensive and it can, what we call preeclampsia,
Yes.
it can get to the level of eclampsia, and the baby can be delivered prematurely. The infection can cause it, congenital anomalies can cause it, chromosomal anomalies can cause it. Do you understand? There are so many things. I'm not an obstetrician, but I know these are some of the things you can see that can dispose to a baby coming out.
Yes. Another interesting aspect of your inaugural lecture was this pamphlet. You called it the Mother's Guide: Common Danger Signs in Newborns. You,
Yes.
of course, compiled it.
Yes, I compiled it.
Now, looking at this picture, there are a couple of pictures here. You talked about a child being unconscious, but I'm particularly interested with swollen abdomen. A child is giving birth to and the abdomen is distended. Tell us, what exactly are the causes, and then what are the signs that you look out for? I know sometimes most mothers, after they give birth, they are tired, some are unconscious, or maybe for the dads and for the caregivers that are around, what are the signs they can look out for to say, this child has an issue, we should call the attention of a doctor?
Thank you. You and I know that when you take in food, it goes through the system and you pass it out. If you take in food and it couldn't go out again, the abdomen will become
It's an
distended.
issue.
Do you understand?
It's an issue.
So if we are talking of what causes abdominal distension in the newborn, it is so many, ranging from the fact that maybe the anus is not patent. So whatever goes into the baby will not come out.
Interestingly, there
You
is this
understand?
time in the course of the child's development, while still suckling, it seems as though there's a window of 2 or 3 days that a newborn does not defecate. Is that a danger sign?
No. It's not. Don't go there, because when a baby is born, yeah, it could defecate within the first day, 24 hours. If it doesn't do that, there should be closer observation.
Okay.
Do you understand?
Okay.
There should be closer observation. If it doesn't defecate the second day, the third day, and you're seeing other signs, but you're sure that the anus is patent. So if the doctor have checked and see that anus is patent and everything is normal, then you keep watching. But if that is not the case, you have to do something. So a baby that is taking food, taking breast milk, should be able to pass stool. In absence of that, you start looking for the possible cause. It's either that the system is not patent, the alimentary canal is not patent, so whatever goes in could not come out, or the baby is infected, or there is other congenital anomalies within the gut that is causing that. So it is left for the expert to, through tests, through examinations and all that, find out what is the cause. But that is not the reason why I put up this thing.
Please tell us.
Why I said it is because I've worked a lot in the newborn life. I said I've practiced in neonatology for the past 14 years as a specialist and 22 years as a doctor. So I've seen that when our mothers come with these babies, they tend to present with complications. Do you understand? Take, for instance, this baby that came with a distended abdomen. It doesn't just wake up and saw distended abdomen on the baby. Do you understand? This baby could have given a warning sign. Maybe a baby that suckles 3-4 times in a night, suckles only once. It becomes a warning sign. A baby that passes 2-3-4 times in a day could not just pass once, but is feeding. It becomes a problem. So that's the earliest warning sign for you to say, doctor, I observe these things in my baby. What is the cause? The doctor say, come, let's look at it. If it's something that can be nipped at the butt, that should be handled. If there's no problem, he will assure you. But looking at this now, this abdomen is distended, is embarrassing the respiration, is causing a lot of problem. Maybe the baby is already infected, or maybe have developed what we call necrotizing enterocolitis. The gut is already in trouble. Do you understand?
Yes.
And by the time it's coming to us, it's coming with numerous complications. The facilities, the bed space may not even be there to accommodate, because we have a challenge of limited facilities,
I was going to go
limited
there.
and all that. So I put up this so that the earliest sign you can see should be a warning sign that will prompt a mother to rush to the hospital.
All right, can you just give us a list of the signs? We have talked about a baby not breathing well at birth. We've talked about distended, swollen abdomen. What other signs?
Let me help you.
Okay.
We're talking of the earliest signs. You're talking of looking at, babies don't talk.
Yes. That's why you
That's
call
the
them
problem.
the minor of minors.
Yes, that's why I call it. They don't talk. They are dependent on you to interpret their problems. But they can show you signs. They don't talk, but they have a lot of signs. But the signs are subtle to the extent that untrained hands don't understand it. And that's what I'm talking about, training our mothers. Let me give you an instance. A baby will show you signs through the cry. Thank God you talked about silent cry. The cry is supposed to be loud. If the cry is not loud, then there may be a problem. Do you understand? So cry is supposed to show a sign through his stooling pattern.
Interesting.
Do you understand? So say a sign through sleeping pattern, feeding pattern, activity, color. Do you understand? Then breathing. Do you understand? So these are the signs that the baby can show you. When there is any problem in these critical areas I've gone through, you should be able to suspect that this baby is trying to tell you, I'm sick. The cry pattern has changed. The stooling have changed. The sleeping pattern have changed. The feeding pattern has changed. The activity have changed. The color have changed. The breathing have changed.
No, some people may attribute it to growth of the
No,
child.
no. You are not meant to interpret it. Once you notice that change, take him to an expert. The expert, that's the problem we have. We try to interpret them. And by the time we are interpreting, it's giving us a baby's yellow. You saw a change in the color. Jaundice. Yellow. You go to interpret it, they'll tell you, no, every baby born can have that. Go and put him under sunlight.
Exactly.
Do you understand?
Exactly.
The third day, the fourth day, the baby will now begin to, start stiffing, refusal to suck, and they are coming with complications. I did studies in the newborn, and I discovered that most of our mothers that brought these jaundice babies, they don't present with it. They say, my baby is yellow. Rather, they will present with complications. The baby have refused to suck. The baby is now stiff. The baby is convulsing. They understand? So they present with complications. And the reason for this, why I developed this, we should actually look at those earlier signs and present with it, not waiting for the complication.
Now, you did mention that mothers need to be trained.
Yes, they need to
I'm
be
still
trained.
going to get to the final action points of your inaugural lecture, because there must be action points from the lecture just to ensure that things go as planned. Now, mothers that need to be trained, what is the framework you plan to use to ensure that mothers are well trained? Because it's one thing to have a message, another thing to deliver the message in the right language to the right people. So is there a framework, just the way you mentioned your SAM SAM about World Asphyxiation Day? Is there any other framework for training the mothers? Tell us about it.
Good. The issue of training is very important. As a researcher, I don't advocate for things I have not proved. I've done a work that shows that training can make a lot of difference. It's an interventional study that I did in 2022. I went into a community, 2 communities.
Here in Enugu?
Yes, here in Enugu. I discovered, I interviewed them on how many of these mothers can tell me spontaneously danger signs they know in the newborn. And lo and behold, it was very poor. Knowledge of danger sign was very poor. To the extent that most of them, the few that knew something about danger sign, could only volunteer fever. Only fever. That's the only thing they know. But I can tell you that it's not only fever that is bad, there are so many of them. You understand? So, training, after that, I went back again, trained them, came back again, and
followed up.
Do you understand? And discovered that after that training, their knowledge increased. And behold, those who can now name up to 3-4 danger signs offhand increased. And those people actually attested the fact that once they see this danger sign, they took their baby to the hospital. So the right healthcare seeking behavior was seen in those people that were able to have good knowledge of danger sign.
How do you plan on sustaining this?
Yes, the more they have knowledge of danger sign, the better their healthcare seeking behavior.
All right.
The earlier they can present to hospital.
You know that I'm really impressed with the fact that you are basing your research on the fact that we are resource limited.
Yeah.
And another challenge that comes with this is manpower,
Good.
capacity.
Yeah.
How has capacity in terms of trained pediatricians, how has it actually increased the travails of the minors?
Yeah, it has increased the travail because you have limited.
Can you
hands
give
now.
me, well, a semi-quantitative estimate of the number of pediatricians as compared to the children? You know, what are the numbers? Because we know that regular doctors, the numbers are just alarming. It could be one doctor to 200 and
2,000.
Oh, 2,000.
That's what we have now. Our
This
WHO
is
recommends
not good.
WHO recommends 1,600. What we have in Nigeria is 2,000.
What's the case with pediatrics?
It's even worse. It's even worse.
You know, people,
If you
it's
look at
as if doctors run away from pediatrics.
It's even worse, and it's worse with the neonatologists. Look at, if you go to our platform, you can only have about 250 something, entire country, neonatologists.
250.
Yes. And I tell you, some of them are not even around.
They've
So
left.
this issue of Japa syndrome is a big trouble. As I'm talking to you now, many people are already packing their loads to leave the country. So we're training and they're leaving. And our people are suffering. So it's a big challenge. I must tell you, it's a very big challenge. Manpower in the healthcare sector is a big challenge. And what does it lead to? It leads to severe burnout syndrome
Of course.
for the few
For
hands
the
that are
people who
available.
are on ground.
So when you come to the hospital, you see doctors are already, if you don't control your emotion, you become, because you're seeing this one coming in with another one is coming, another one is coming, only on one person. So it's a big problem.
I'm glad the SSG was there to
Yeah, we
hear your-
emphasized all these things. The lecture was very global. It brought a lot of things, a lot of issues into limelight on how we can help our people.
Now,
You understand?
while we were talking initially, you did mention something that was very important about your inaugural lecture. You said two major take-home. One is awareness training of the mothers. There's a second action point. I want you to elucidate on that action point.
Okay, in the inaugural lecture, I talked about training. That's creating awareness, global awareness, a very massive awareness of asphyxia and the cause of asphyxia and how it can be prevented. Then I talked about the issue of maternal education.
Yes.
Do you understand? And I said, if we're talking about maternal, I believe in grassroots, that I'm going to work with the Ministry of Health to develop a curriculum. Do you understand? So that we can begin from the secondary school to train our mothers to be.
Secondary school.
Yes.
Interesting.
Yes, so that if you domicile a newborn, maternal and newborn health, do you understand? Where you can bring in this danger sign and teach it to secondary school leaver, maybe from senior secondary school. As you're coming out of secondary school as a mother, as a prospective mother,
yes, you're
as
already
a
equipped
girl,
with
you're already
knowledge.
with knowledge of danger signs. So that if you eventually finished and got married, the first baby you're having, you're looking out for it. That is how societies that want to solve their problem operate. It's not a haphazard thing. Let us start it from the grassroots. Let there be a structure. Do you understand? Let there be a curriculum that when they come into their civic education, or it can be a standalone topic taught as maternal and newborn health.
Health.
Do you understand?
It could even come
Then
under civic education.
it can come under civic education. That's what I proposed in that my paper. You can see it here. You understand? So I said it can come in. I can work with the Ministry of Education to get it domiciled. It can be just few hours topic that be taught to these students, so that as they are coming out, they're already equipped with danger signs. They can even visit somebody in the house and see a baby in the house. I say, this is dangerous.
Yeah.
Take this baby to the hospital. You understand?
Interesting. Now, you've done a lot of work.
I've done a lot.
You have. You're
I've
even
done
a
a lot.
co-inventor.
Yes, I invented
What
it.
is NUA
Dude,
tape?
NUA tape is NUA tape. You know, when people say NUA, I said I use that word NUA because I want it to go far. NUA is in the Bible, even though it's not the same spelling.
It's not the
Do you
same,
understand?
but
But when
same
you hear say
pronunciation.
NUA, NUA is a common distance. So everybody knows. So I said NUA. I invented it with my colleagues. It's not just me.
Yeah,
The
you were a
three of us
co-inventor,
worked
yeah.
on that.
Tell
So
us about it.
N, it stands for, is already patented. Do you understand? It's a non-stretchable tape that can be used to identify babies that have low birth weight. Do you understand? Because birth weight is one of the signs that you can use to identify a premature baby.
But why
Do you understand?
use a tape when you can weigh the child?
Good. Go to our rural areas where 70% of the birth take place in the home. How many of them have weighing scale? How many of them know how to read it? How many of the scales are working? That is our problem. We should look at how to solve our problem.
Indeed.
I'm a grassroots person.
Indeed.
Do you understand? So I said, we develop this tape so that they can take it to the hinterland, take it to our rural people who the skills, or what the skills are bad, it's not maintained. Do you understand? So that if they get this tape, strap it up. And if it ends in the red zone, run. This baby cannot be managed in a non-standard facility. If it ends in the yellow zone, well, you can manage, but you must be looking out for danger signs. And at the earliest prompt, you take the baby to where the care can be received. If it ends in the green zone, then you can comfortably manage, but still be watching out for possible danger signs. So it is something we developed out of our experience and practice so that we can be able to attend to these babies at the grassroots, especially with poorly trained or untrained hands. Do you understand? No specialists that are handling these babies. Because give it or take it, most of these deliveries are still occurring at home.
Interestingly, before we go, yeah. Go ahead, sir.
So
Go ahead.
it's still occurring at home. And that is what another place, the engine that is manufacturing asphyxia. So in this book, I'm talking about how to promote facility delivery, how to make our mothers come to hospital to deliver. Don't deliver at home. You are not goats. You are not animal.
All right.
Do you understand?
Well, before we go on a break, I guess most of them don't come to the hospitals, not because they don't like hospitals, but some of them don't even have the transportation or the means of coming.
Good.
Now,
I must also tell you another thing that scares people away.
Yes.
If you go to hospital, even the attitude of the health workers can scare people away. So I said in this is my book, that we work on the attitude of the health workers to give them a receptive hand so that they can come. Then we should be able to, cost is a major thing in the resource-limited setting that scares these mothers away from the hospital.
cost.
So hospital, government have to step in. They can subsidize.
Yeah,
the
subsidize,
cost of delivery.
yes, yeah.
They can offer delivery packs at a subsidized rate to these mothers so that they can come. They should also place a ceiling for the charge of normal delivery and cesarean sessions within the state. So you don't go beyond that. If you want to go beyond that, maybe because of specialist care you've given, you must clear with the Ministry of Health. I said I can work it with the Ministry of Health. But another thing I said that I'm also going to do is to make sure that these facilities that take care of pets are accredited. Do you understand? So
Isn't that the job of NMA?
It's a collective job.
Okay.
Both NMA, both State Ministry of Health can work on that, even if Federal Ministry of Health. So you have accredited centers for child births,
Delivery.
and it will be designated in the signboard. Just as you see secondary schools and primary schools say accredited there should be accredited center for child births, so that you don't have any business entering anywhere, any place to go and deliver a baby if you don't see sign of being accredited.
Interesting.
Do you understand?
Interesting. All right, we're not done. Prof, you have a lot to give.
I have a lot.
I can sense it. We'll still talk more, but right now we'll have to go on a break. And when we come back, we're going to go online to find what people are saying about this topic, and we're going to discuss it, and then you're going to be busting some myths for us. All right. So do stay tuned. Don't go anywhere. Inside Health continues right after now.
We are local.
We are right now with the wife of the man that was
Why the main market is in chaos? People
We are national.
Those in support of this motion as amended, say aye.
we have taken the vote by default.
We are international.
Israeli airstrikes.
Donald Trump left us the worst unemployment.
Signature TV, news in your pocket.
Welcome to my Doctor and I segment on Inside Health. Don't forget that we are still discussing silent cries and how to recognize life-threatening signs in newborn. So this is where we go online and then we glean some tweets online and then we try to discuss it. So Ngozi Cares, a community health advocate, says this is heartbreaking but sadly not surprising. We urgently need better training for health workers in rural areas. When will the government invest where it truly matters? You know, like I said, the SSG was in your inaugural lecture. When will he give you a feedback?
Well, in fact, he said in his speech that we can work with the Ministry of Health, that is the Commissioner and the Ministry of Health, to see how we can kickstart this proposal. Do you understand? I've called the Commissioner for Health. He has invited me.
Interesting.
I'm going to go.
Interesting. So there's light at the end
yes,
of the tunnel.
there is.
All right.
Definitely.
Moving on, Musa Baba 89, a concerned father says, I lost my son at 3 weeks because we didn't know he had an infection. How do we educate families better on newborn danger signs? I guess that's what we are doing here.
Good, that's what we're doing. And we have developed the mother's guide.
Yes.
You can see.
If the camera can just capture this, how can we make this available?
In fact, I tried as much as I can because I shared up to 700 copies of this in my lecture as a souvenir. And at the back, you have that.
Yes.
Look at it.
Yes, yes.
You can show. So that's what I showed. So anytime you see any of this sign in your baby, it is a danger sign. You just have to take this baby to the health center.
Hospital.
You understand?
All right. Moving on, Zainab Wright. Wow, I guess this is going on now. It says Professor Ekwochi's interview is a wake-up call. Why is neonatal care still such a low priority in national health discussions?
Because I told you, newborn is helpless. They are not political. They can't talk. When they cry, their cry is low because their vocal is low. We are only the one that should advocate for them. If they are politicians, they have big money.
Know how to fight for themselves.
They know how to fight for themselves and get into the policymakers. They understand. But I tell you another thing. Because we are advocating for them. That's why we're doing all these things. And if we don't do that, if they don't survive, I wonder what will happen to the next generation. Because if we want to have the next generation, we must care for our newborn today. That's
interesting. Moving on, Hope for Every Baby, an NGO account says we must amplify this. No baby should die because of poor infrastructure or lack of awareness. We're working in Kano to train birth attendants and others should join.
That's a good one.
Yes, yes.
That's a good one. That's a good one.
So,
Makina.
Yes.
Carry on.
So do you think community health workers, what should be their role?
Everybody have a role in this call, wake-up call. Everybody.
So there won't be any professional, squabble as to this is my area, you're not.
No, you remember that I said in the Stop Asphyxia movement, both the professionals in terms of healthcare and non-professional. If you don't have, if you can't train, you should be able to support. Do you understand? Because we are going to train on neonatal resuscitation, we are going to train on essential newborn cares and other practices that will enhance newborn survival. So training is part and parcel of it. Do you understand? Awareness, massive awareness, is part and parcel of it, of our mission.
All right.
Because when we bring all these things together, we should be able to stop asphyxia.
Hopefully. Interesting. Mr. Ikenna, a teacher, says this is a societal failure. If we can't protect our most vulnerable, what hope is there for the rest of our children?
He nailed it.
He nailed it.
He nailed it. If we can't protect them, they're in trouble.
Well said. Titi Talks Health, a health blogger, says, are there any mobile apps or local campaigns currently helping parents recognize early signs of neonatal distress?
Good. If you look at this book, this is my public inaugural lecture.
Yes.
I emphasized, I said, we have developed this today as a mother's guide. When I'm in a short while, There will be an app.
An app.
That will educate our mothers on danger signs. It will be in their food, so they'll see it.
We have a lot
Last week,
going on.
I shared it as a flyer, but soonest we'll have it as an app.
Wow.
Because we have to stop it. It is
I applaud
preventable.
I applaud your vision.
Thank
I
you.
really do. And you will get help, all the help and the support you need.
Thank you so much.
Yes. All right. Adamama NG, a mother and advocate, says, as a mother, this hits hard. We need village health outreaches, not just hospitals in cities. When will rural mothers matter too? This is a very emotional
It's
one.
very emotional. Very emotional. Because I told you, 60% or more of the deliveries actually occurs in the rural area. And that is where these asphyxias are being bred. So if we don't do anything to get them involved, let them know this thing is preventable.
Yeah. All right. Dr. Eze, public health, a medical doctor, says, very timely, Prof. Ekwochi is right. Our system is reactive, not preventive. Training for traditional birth attendants must be scaled up urgently. Interesting.
Fantastic.
So many people sharing your sentiments.
Yes.
Yes.
Because it is hewn out of practice.
Out of research,
Out
too.
of research and practice.
It's evidence-based.
It's evidence-based. We are not talking about something that is not with us. It is here with us. The knowledge is poor.
It is.
Because they will end up coming with complications and not the initial signs. So if we train them on how to recognize this thing as it comes, they don't have any business with complications. They will handle it. Jaundice will show you yellowness
Of the eyes.
but they will not come. They will come when he has damaged the brain. And the baby is now an imbecile. So what can you do? Even with all the big facilities around, even in the best care centers, you may not be able to
Help
salvage
the
that
child.
baby again.
All right. Lukman speaks. A youth leader says, this is beyond sad. What practical steps can young people take to support newborn health in our communities? Like you said, we're all stakeholders.
We're stakeholders,
Yeah. So
yeah.
what can young people even do? Which I should agree with you that awareness
From school.
so that a young person can see a child of a mother who is clueless and say there's an issue here.
There's an issue here. And they will give you a clue on how to go about
Go
it.
about it.
It's not
not
high
rocket
value thing.
science.
It's not rocket science. It is something doable in our environment. So as soon as this movement is kicking out, it's going to be very, very radical. We're going to have a radical movement to ensure that we stop asphyxia. We make danger signs known to practically everybody in our society. So that as soon as you notice it, you rush to a health care center and get care. You understand?
Yes. Obina Codes, a tech developer. Why don't we have a national newborn health tracker app yet? Talking from his
Good.
his experience. Parents need accessible tools to monitor baby health and symptoms.
That's technology.
That's technology.
That's technology. Yeah, they have a role. I've told you about the app we're planning to
yes,
develop.
yes.
It's very important. Everybody should come into this
Fight.
And I know that by God's grace, we'll get some huge success.
And a big amen to that.
Thank you.
ZCare Africa, an NGO representative, says we've been advocating for decentralized health education in Hausa, Igbo, and Yoruba. Wow. Health literacy should not be a luxury. So they're trying to decentralize knowledge in the different, because most of this
That's
is
fantastic.
Yes,
That's
it's a great
taking
job.
it to the grassroots.
Yes.
They will understand it better. Put it in the simplest language they can flow with, and it will make a lot of difference. It will make a huge difference.
Interesting. Now, the Mama Forum is a parenting group. Can we talk about postnatal visits? This is interesting. Many women never return to clinics after childbirth. How can we fix follow-up care? Because if there are some of these things that could actually have been identified if the mother had come for postnatal check. Yes. So, does the scope of the movement accommodate postnatal checks?
Well, it may not be, but it's not out of order. Do you understand? Postnatal care, postnatal visit. You know, the challenge of postnatal visit in our system is numerous. One, you talk of security, you talk of acceptance, you talk of availability of health workers to even do that. Do you understand? Because you're actually meant to go and survey the environment where this newborn is going to be cared for after leaving the hospital. Do you understand?
It's labor intensive.
And when you get there, you could also pick this danger sign because you're a trained hand and say, madam, this is a danger sign. Let's go back to the hospital. So it's wonderful. You understand? But if
Maybe
we also
in
train,
time.
if we've also trained these mothers to pick it themselves and come, since we can say if Mohammed cannot go to the mountain, the mountain should come to the
Better
mountain.
still, the
You
mothers
understand?
can pick it up.
They can pick it up and now come to. So we're not throwing away postnatal visit entirely, but we're saying let's also even educate those who are, because I tell you, the mother is the best doctor for the newborn. Do you understand? The mother is the best doctor for the newborn. He stays with the baby 24 hours.
Sleeps, wakes up.
Yes, wakes
does
up with the baby.
everything.
So the earliest danger sign the baby is going to show, he will show it to the mother first. It's only that the mother will not be able to recognize it. The cry has changed, the mother didn't recognize it. The color have changed, they couldn't recognize it. The stealing pattern have changed, he couldn't recognize it. Do you understand? The feeding pattern has changed, he couldn't recognize it. The activity have changed, the color have changed, the breathing have changed. So how do we make these mothers to understand this? That's all. So that they can come and hand this baby over to us at the earliest time.
To avoid complications.
To avoid complications.
All right, finally, Ibrahim Kanu, a policy analyst, says this isn't just about hospitals, it's about governance, budgeting, accountability. Do we know how much Nigeria spends on neonatal care annually?
That's a problem. That's the issue. He's making a very big point.
A very big
Because I told you, the newborn is not a politician. So he
A
may not
very-
be able to get a large chunk.
So from the health budget on health.
But I thank God for in our own local state.
Yes.
You see that the budget to health, in fact, the two major sectors that had the highest
Health
chunk
and
of
education.
the health and education.
Yes.
And that shows a society that wants to develop. So our own governor is an action man. Do you understand? So if you want a society to go far in development, you must invest hugely in education and in health. And that is what we're talking about. So education is not just
health education.
yeah. And you see how type 2 primary health centers is springing
Coming
up
up
in all
in
the
Enugu.
world. So
Yes.
it shows you a man who really wants his people to survive. So kudos to our governor.
Kudos to our governor.
Doctor, yeah,
Yes.
Dr. Barrister Chipita Ndubisimba has done a lot, and he's still doing it. He's still on it. He's not backing. He's doing a lot massively to ensure that we have the next generation in Enugu State by giving us good health, good education.
Aren't we
So
blessed?
thank you for that.
Aren't we blessed? Thank you.
We are blessed.
All right, so these are some myths. I told you you're going to be busting some myths because there are some misinformation that we need to correct based on this. Now, myth one says, if a baby is meant to survive, it will survive. More like saying, what will be. If he's meant to stay, he will stay.
Thank
If
you
he's
so
not-
much. Thank you. God give. God has taken.
Exactly.
In fact, just clean your eyes. Go and prepare for another one. Yes, because they say, see the baby as he's not contributing to the finance of the house. In fact, the mother can always bring out the baby.
Bring out, yeah.
Do you understand? So
Yeah.
he can also bring another one. They say, go. Don't worry, God, he has gone. Go and prepare for another one. It's not good.
The lack of responsibility.
You didn't know that one that is being wasted could be the next president. It could be the next minister. It could be the next professor. Do you understand? And because he's still at that stage, he could not talk. He doesn't have power. He doesn't have any energy. You just waste him. That's bad. Do you understand? Think of what he can be in future. Think of what if I was wasted when I was born. Do you understand? And I'm not a professor, and I've done a lot to
doing
affect.
so much work.
So, had it been that I was wasted, just think of the person that is saying it. Think of you yourself. You were wasted when you were born. You were not given the appropriate care. And now you have seen what the impact you've been able to raise in the society. If you were wasted, you won't be able to do that. Imagine that our own governor was wasted when he was born.
Don't even go
And
there.
see the
what he's doing.
massive development that is happening in Enugu State. Are we not blessed to have that kind of person?
Indeed.
So if he was wasted when he was born,
Every child is precious.
Everybody is precious. So we shouldn't see that's the problem we're having. So they don't give that.
All right, let's get to the next one because we're already out of time. Seizures, of course, convulsions or yellow eyes in newborns are spiritual problems.
That's another issue. It's a spiritual problem.
It's a medical problem.
It's a medical problem completely. There's nothing spiritual there.
About it.
Do you understand? And I tell you about this illness of the eye. I've done a lot of study on it. And there are people who believe it's spiritual. One, they say go and get Otangele and put it there to clear. put breast
Local
milk,
eyeliner.
put breast milk, drop it in the eye. Who told you that? That is not the
I
problem.
guess this is what education and
Good, we're going to do that. We're already
enlightenment,
doing that so
yeah.
that pigment that is causing yellowness of the eye is also causing damage to the brain. There is no place sunning the baby. Take that baby to the hospital. Let the experts see the baby. In a short while, if you don't do that, that brain will be damaged and baby will become an imbecile. You
wow.
understand? So there's
Yes.
nothing spiritual, absolutely no spiritual issue.
All right. Next, how home remedies or traditional herbs can treat all newborn illnesses?
I must tell you, well, see local concussion. He has done a lot to our people, and I have a research on that. Do you understand? The issue of having all these congenital
Why
anomalies.
are these people who peddle local concoctions, why are they not being regulated?
That is failure of the arm that's supposed to regulate it. Somebody, if you go now, the next morning, you go down to the village or go to your street, you see people peddling a lot of herbs, unchecked, and the people are drinking it. They say, drink this one, it will make you lose weight. Drink this one, it will make you conceive. Drink this one, it will make terrible, terrible things, and people are drinking it. And when they
So
bring out their
sad.
baby, it is
So sad.
it has a lot
There's
of
even
congenital
one. Let's not
anomalies.
go there. You drink it so that your baby will be lean,
Be
so you can
lean
come
and-
out the birth
yeah.
canal without causing much damage.
That's a problem.
Well, we're hopeful that education will do the needed work it needs to do so that mothers can do better. Only first-time mothers need to be taught about newborn care. And you would see that after the first child,
that's terrible.
subsequently they hardly come for antenatal
yeah,
because they
they
feel
hardly
they are
come.
now
Yes.
lords in this.
And do you know why I'm talking about the mothers? Do you understand? Because the mother is the best doctor for the baby. And I tell all the mothers, please get close to your baby. Do you understand? There should be rooming in. That's why WHO is advocating 24 for exclusive breastfeeding.
Yes.
Feed this baby with breast milk alone for the first 6 months. Breast milk contains everything that the baby needs. Do you understand? So stay with your baby so that you can pick these signs as early as it comes. I know that there is a mugo. Your grandmother will come, relatives will come, you have a house help and all that. Don't hand over your baby to your house help or to your mother-in-law. It is your baby.
It's your baby.
Hold him, hold that cuddle. Do you understand? Be very close so that you can pick the sign. The bonding should be there. So you can pick the sign as you are his or her doctor.
What's the cure for laziness? Many mothers actually.
That's the issue.
Many mothers.
That's the issue.
Actually.
So they deliver the baby, they hand it over
They hand
to
it,
the
yeah.
house rep. Hand
I've
it
done
over
the work.
to mother-in-law.
Yeah.
And that's all.
All right, finally on our myth busting, it's the mother's sole responsibility to keep the baby healthy. Is that true?
Yes, is this mother's soul is the mother's responsibility. The father should also not neglect that. It's everybody's responsibility. Because I said in that in fact my closing word in my inaugural lecture is that newborn care is everybody's business.
Yeah, responsibility.
It's everybody's business. Do you understand? If you're walking along the street, you see a newborn, enter into any place, see a newborn being abused, please don't shy away from that. Raise an alarm. Newborn care is an emergency. It's everybody's business. Everybody, every stakeholder should be interested on what is happening to the newborn. So that we're able to save the next generation.
We've had a lot to talk about, Prof. Ekwochi. Any parting words, advice, suggestion to a new mother or returning mother, anybody that is
Yeah, what I
watching?
want to tell the people, people listening to us this afternoon, is that the killers of newborn in our society are largely preventable. Do you understand? And there's it's a wake-up call to everybody to join in this movement to make sure that our babies are safe. They are largely preventable through very practical, cost-effective steps anchored on public education and female empowerment. If we can champion that today, our babies will be safer.
Public education
understand?
and female empowerment.
Good.
Well, that's the much we can take. Thank you so much, Professor Ekwochi. It was a very enlightening session.
Thank you.
I'll have you back here
No problem.
some other time because I sense you have so much more to give and the people need to hear what you have to say. All right. Thank you so much for staying with us up until this time. We want to hear from you. I'm sure you two are itching to say something. So go on over to our social media platforms at Signature TV Official. Go and drop a few words so that we can know what exactly it is that it's in your mind. Also, we are live 247 on SLTV channel 265. Don't forget, your health is your responsibility. I'm your host, Chigichi Agoram. See you same time next week.